Okay, so on our panel today we have Patrick from Marysbridge High School. We have Jacob from Appleton High School, Faith from Mount Hebron High School, Ashley from Glenelg High School. Bobby from Mount Hebron High School. I was going to tell Bobby to bring his own chair, but then someone brought a chair for Bobby. We have April from Glenelg Country School and Anita from Longreach High School. So we definitely have students from all over the county. And in a second, I'm going to have them introduce themselves just by telling their grade. And you'll see that we have students from as low as 9th grade to our seniors.
Hi, I'm Patrick Keefe. I'm a senior at Marysbridge, and I'm also an intern here at the health department.
Hi, I'm Jacob Lamp. I go to Adolescent High School, and I'm a member of the Howard County School Health Council. 12th grade.
Hi, I'm Faith. I'm a sophomore at Mount Hebron, and this summer I had the opportunity to be an intern. Mr. Jones.
Hi, I'm Ashley. I'm in 11th grade at Mount High School. I don't have anything that interesting to say.
Hi, I'm Bobby. I'm a freshman at Mount Hebron, and same as right.
Hi, my name is April Murden. I am a junior at Glenelg Country School. I actually have a pretty personal experience in the mental health world, so I can bring in some insight with that during the questions.
Hi, I'm Anita from Longreach High School, and I'm a senior this year.
So we definitely have some students with some personal experience as well as some experience with some of their peers directly. So we will start with the first question, and we'll start right here with Patrick. What do you perceive to be the major mental health and substance misuse challenge facing youth and teens today?
So the main challenge I see with mental illness in Howard County is the negative stigma we associate with it. And so here I'm a student intern with the intermental program with Howard County Public Schools, and I'm working under Dr. Jackie Dujet back there. And so what I've noticed is when I'm researching mental illness, I came across this really interesting concept, and that is when a child is diagnosed with cancer or diabetes, everyone takes a step forward to help them, publicly show their support, be like, oh, I'm here for you, whatever you need. But when a child is diagnosed with whether depression or anxiety, people take a step back. And you're not really open to being there for them. You don't want to say, oh, like my best friend has depression right now. So it's something that, with 1 in 5 high school students developing it, you would think 1 in 5, that's the amount of students who are developing a common cold, but it's 1 in 5 who are developing depression. And when this is such a serious problem, you think that we'd be more accepting, but that's not the case. What I found in Howard County is that, for one, I don't really know the resources that are available to us. A lot of students go through this, we call it the silent war. You don't really want to share your experiences, you don't want to talk about it, and you don't know who to talk about it, so you just kind of sit there and you go in that downward spiral that the medical professionals were talking about. And another thing is that it's just, in Howard County with such high standards on our students, a lot of people don't feel it's acceptable to feel this way. It's acceptable to feel anything below above average. And I think that that's the main problem that many students are facing.
Thank you. Something that hasn't necessarily been touched on, yes, we've talked about stress, and trust me, I'm all for how that's a huge issue in this county, but something that students I'm seeing are starting to do to deal with this stress is becoming hooked on sleeping pills. Personally, I had to go on a sleeping regimen, and not necessarily a pill, but it just helped. It wasn't a pill, but it helped. And I know people who have become hooked on sleeping pills because of the amount of stress they're put through the school day, and they can only get 2 to 3 hours of sleep each night if they don't have those sleeping pills, and it's a downward spiral because, you learn anatomy. If you take enough of something, your body stops producing it, and when your body stops producing these sleeping chemicals in your brain, you're not going to be able to fall asleep without the extra help. So something that I really want to stress is that the way students are starting to deal with this types of stress is through sleeping aids and sleeping pills.
So
So one of the major issues that I think is, I know you probably hear this a lot, but school plays such a big factor into our lives. And when life is hard at school, then life is just hard in general. And so I think that similar to what he said, is that like the stress of it just causes you to do certain things that you normally wouldn't do had you not been put under this pressure. And I think what I see normally is I've seen people who use different drugs. I've seen people who do different things, and it gets to a point whereby it's like you want to be able to control it, but you can't because you just have so much pressure at school, and as much as your teachers try to help, there's also a certain expectation of teachers. And then it just goes up the line to the point whereby it's like, I don't know where all of this is coming from, but at the end of the day, it's landing on me. And so it just becomes very difficult for us to deal with it, and so that's why we turn to multiple different things to kind of relieve ourselves from it. And that's what I think is a major issue.
I think that Howard County has created a climate that makes academic rigor and achievement, it puts it above the development of happy students, because students are constantly stretching themselves too thin, all in a sense to be deemed smarter than their peers and to appeal to colleges overall. And there's so much pressure on these students to be the best. And you need to ask them, what exactly is the best? How do you define the best? And why is it important to be the best? Because kids think that you have to take the hardest classes, do all of this stuff, when you don't really have to do that to achieve what you want to. And not a lot of kids know that. They're constantly comparing themselves to their peers, and this competitiveness is not good for their overall self-esteem, so it's just creating a very stressful environment overall.
So the things that I don't really know what the main problem is, because I just started high school, I'm a freshman, so they just like sugarcoat everything that's going to be easy, you're just going to go through high school. No. The first few weeks I realized that, yes, there's a lot of stress with high school. I am getting some of that now from like all the math and all that stuff. It's a weird experience just to start it off and then realize like, oh God, there's a lot of problems here. I'm just figuring it out now.
Okay, so I was going to say, for my personal experience, I knew everyone around me was stressed. My friends were stressed with whatever was going on in school, assignments, papers, and I thought I was stressed too. No one really asked me in specifics, how are you? So they would say, like, how are you? And if I said good, that's a good enough answer. No one really dove deeper into that. So I just thought I was stressed. I thought it was normal. There's a lot of hard work going on. It's normal to be stressed. There's nothing really different with me. Once someone started, I guess, noticing that there were some more deeper issues going on with me, I was talking about it, and I think that I probably said some pretty depressing things, but once I was actually able to verbally express them, I think that's when I started discovering that there was an issue going on. I think in the school setting there should be more room to talk about specific feelings, not just, oh, I'm doing good, oh, today's stressful, just more specific feelings. I didn't even really know that there was anything special going on. I just thought I was normally stressed like everyone else.
So we talked a lot about how kids would use drugs because they're stressed, and this is a form of escapism. But the problem is that there's also this stigma for kids who use drugs that they are usually kids who are problematic within the school system. So they're low-performing kids who don't care about their grades or like their homework, their GPA, all that stuff. However, this is not the case. I think a lot of kids who could be your most high-performing kids could be the ones abusing drugs. And a lot of times for some kids, it's not just because of school. I mean, that's a really big, important factor, but there's other stuff involved. Like, they may not see their parents a lot. Their parents are always at work. They have nobody at home who cares about them, really. Nobody who comes home and asks, how are your day? How are you feeling? So a lot of times they use it out of loneliness, and it's something they can use to cope with at home.
And a lot of you touched on the thought and the idea of school. So what insight would you, in home life, so what insight would you give to parents, your teachers, your school administrators on exactly what the issue is?
I think an important aspect of that is to just be open-minded. You don't really understand what these kids are going through because with our athletic directors, our teachers, our parents, there's kind of been a difference in how we were raised compared to how they were raised. Colleges these days are a lot harder to get into. Like my personal experience, my dad went to Boston College. He got in because he knew the priest. Nowadays, it's got a 20% acceptance rate, so it's a little bit different now. I'm trying to go there, and it's just that times have changed, and I think that our opinions need to change with that. Kids are, starting to speak out about the stresses in their life, and I think that it's important for everyone to listen and to realize that something is wrong and something does need to change.
So we've all talked about stress, but what's causing that stress in school? Is it getting the grades, getting the girl, being popular? I think all those do play factors, but I think the main thing, and something Ms. Wagner touched on, is over-testing. Over-testing, in my view, is the biggest issue of our school system as of right now. The environment in schools have changed. Students have become data points, upward sloping graphs. We're treated as part of a collective rather than individuals. And I strongly disagree with that. I really believe that if we were to take a step back and look at how students really view this, it's in a negative light, the amount of testing we get. And so some examples of this, I'm going to name some names. The PARCC testing. PARCC testing comes in the middle of APs, and it's another standardized test, state-mandated test that we have to take. I understand that we get the federal funds if we take the PARCC testing. But what we have to start doing as a community and as a county and as a top-performing county is to value our students over the amount of money we're getting. We need to look at these tests and ask ourselves, are they worth taking time out of the classroom day, which will in turn end up with more homework, more stress at home, away from instructional time. And something similar to that, we have these things called student learning objectives that teachers have to take every month or so. These are very problematic. Teachers, now I understand like throughout the 80s and earlier, teachers' evaluations were not necessarily tied to a student's performance as strongly as they are now. And I believe, yes, the pendulum has swung, but it's swung too far. Teachers can't teach the way they would like to teach anymore. They're stuck to these data requirements and data objectives. And so in turn, what ends up happening is a teacher will give an easier test or harder test at the beginning of the year and make it easier at the end of the year so that it shows that upward slope. This is a huge issue, and it's only taking time out of the classroom. It's only stressing students out even more than they need to be with ACT testing, SAT testing, getting into that college, and then all the other factors I listed, grades and girls and popularity or boys, whatever you're into. But it's really compounding all the stress that high schoolers are already under, and it just does not help any of us out at all.
So I think that one insight that I can give is that, so I know I actually have served on a lot of panels, and I think one thing that's very interesting to me is to hear what the adults have to say, because sometimes I'll sit back and I'll be like, you have no idea what you're talking about, like honestly, and it's just so different from what we see as students. And so one thing that I think it's very essential for adults to understand that you can study it, but until you really live it, you have to really listen, because as much as I served on this past year for this Thursday it'll be 5, and that's just one person. But why aren't so many other people speaking up? Because if you don't hear from the other people, because I'm just one person, we are all just individuals, and there's so many different people in our schools who are so different from us, and it's just so essential to hear what they have to say, because personally, I don't use drugs, but I know people who use drugs, so why not hear from those people? Why not understand why they're doing it? Because I can try to explain why I think they're doing it. Maybe it's stress, or maybe they just want to, because that is very, very real in our school systems. And I think that sometimes we try to make excuses for all these things that are happening, but at the end of the day, it really is a decision for students. And I think it's really important to understand that and to sometimes put a consequence to certain things that we do, because I have seen people who use drugs and who their parents even know they use drugs. But I mean, what can they do about it? Because it's like if your parents know, then it's okay. And so I think that it's just really important to hear from other people and have a lot more students speak up and not be as judgmental towards those students, because students don't want to speak up because they know that if they do, they're all going to get judged. And it's the same thing with mental illnesses, that if someone speaks up and says, I have a mental illness, there's a certain negative stigma that comes with that, and they just don't want to. So I think that one thing that's very essential is to have students speak up more and to just be willing to listen and to accept it, as opposed to just trying to understand and look for some deeper meaning into it.
Okay, so I think that we've established that stress is a big problem. I'm just going to add on to that. Students are reluctant to go and ask for help when they need help, and help definitely, like asking for help will make their lives easier, and it's important that we make sure that kids know that, because if they just try to balance everything in their lives, it's going to become very hard for them to do all this stuff. So I think that helping students acknowledge warning signs, like are they constantly tired, are their grades dropping, are they having trouble maintaining friendships, and like letting the schools know, letting their parents know, and plan how to combat these stressors so they can live their lives more happily and just really help the quality of life for students.
So like we keep getting pressured from everyone to do well, to do this. Like honestly, like we may need like a break throughout the middle of the day. Like I'm looking forward to the next week because we have a spirit week, so that means we get like a 20-minute break between like first and second period, so we can release some of that stress, talk to our friends, understand what's going on. Like Wednesdays where we have Mount Hebron biking time, or like 30-minute periods to talk about school stuff and everything. But like, like it's those kind of breaks that we're looking forward to, because we need that like little stress reliever so that we can get through the rest of the day and understand what's going on through the rest of the school year.
Okay, so I think that a big part of the school environment is also social, rather than just academics. So socially, I remember for me in middle school, there were some pretty mean girls, and I didn't really fit in with them. I didn't really know what to do. I didn't know how to fit in with them. And it felt like the teachers were pretty much only concerned about academics. I didn't really know who to go to for my social concerns in school, and that was a big part of my school life. I mean, I had good grades. I wasn't really worrying about that. It was pretty social for me. Also, another thing, judgment. So I think we talked about this. There's a stigma that goes along with mental health, not only with depression, anxiety, also ADHD. When a teacher says, hey, you gotta calm down, you're being really hyper. I mean, I've had people say that to me actually yesterday. And I was pretty hurt by that. I'm like, that's just me. Like, I don't know how to exactly change that. Like, I have a whole list of coping skills, like I can squeeze a ball, but I don't always really want to do that. Like, I just don't want to be seen as like a normal student. So that judgment kind of hurts. With that judgment from that teacher, I don't really want to talk to him about my emotional, anything that's going on in my life. I just felt hurt from that experience. So I think an open, like, stance can help a lot. Maybe if he said, how about we try doing this? Like, just going out and saying, you're too hyper, you need to stop. It's a little upsetting. So I think just social aspects of the school environment, and then just kind of the judgment that goes along with other mental health. I think those are two ways that could be a step forward to improving mental health in the school environment.
I think there's many causes as to what causes like substance abuse and mental illnesses. However, so not necessarily all mental illnesses, but I'll give an example, like eating disorder specifically. Schools can cause that because you are so stressed, and personally I see eating disorders sometimes as addictions. So coming from that point of view, addictions, you need to figure it out yourself. You need to look in yourself and see that I have a problem, and you have to identify it yourself. Oftentimes, adults can't even help you with something like that because it's all in your mind. So you have to recognize it yourself and know to take the step forward and be able to like not be ashamed of yourself and be like, I need to get help for this. Kind of lost my train of thought. So at first when I got this invitation, I like looked at the questions. I was confused too. I was like, why aren't you asking people who do drugs? There's many reasons people do drugs, I think. They're all different. You can have your like very deep reason, like they're stressed out from school, their parents don't pay attention to them at home, they have family problems. Sometimes you have kids who just do it for the fun, they can afford it. But it all comes down to, I think, a lot of times how much people pay attention to us around us, and the school is a big factor. Our teachers are, as many have stated, focused on academics, and I feel like a lot of schools, there isn't as much as a teacher-to-student relationship, so that needs to be emphasized. I feel like you get to know your teacher, have them talk to you about just, if you want to talk about like college stuff, know that you can go to them. A lot of times we go in their class, we do their work, and we get out. And a lot of times you might not like that teacher, and that's why you're performing like badly. But it's more so that we should emphasize that relationship between teachers and their students.
So, and I think that a lot of you have touched on this, but what do you feel, if you want to add anything or some other answer, what do you feel about the root of the issue?
So I've had this question for about 2 weeks now, and I still think that I can't really understand it because it's asking what is the root single, and I think that's the issue, that we have this conception that there is one cause of depression or mental illness or substance abuse, and that's the problem. There are so many different factors in our lives that can lead us to this. I'm gonna, for one, academics, like when I was a sophomore at my school, we had this week-long program called I Heart AP Week, and every day you would have 30 minutes taken out of your day and you'd have to attend an AP class lecture and be told like what that class is, and that's how you had to spend a day. And the following year you were expected to take at least some of those courses. And so when you are forcing these students to be taking college level courses in high school, that is just completely overwhelming. And I know that for many of my friends, and myself included, my junior year of high school, I had numerous sleepless nights because I was up all night, typing up a paper, doing a project, or clubs as well, doing plenty of stuff for clubs. And it's just, that route that we are expected to do so much is just something that overwhelms so many students, as well as the social aspect. We are still expected to maintain, this great social life, be involved in the community, play sports, get in clubs, and that's just, it's asking a lot of us as students. And I think that that's the route that we're expected to do so much, and that when we can't meet that, when we can't get the A in the class, when we can't score a goal, it's just, we feel like we're a disappointment, and I think that these high expectations are ultimately the root, because if we don't meet them, we feel we are failures, and I think that's really worrisome.
So again, just reinforcing my points that I made earlier, it's stress. That's the root of majority of these issues. If students stressed out, they're going to be doing things that they normally do. So what specifically causes that stress? Well, I've identified something. It's the testing. It's the amount of testing, the frequency of the testing, and the effectiveness.
So I actually am going to look at this through a different perspective, and I'm going to say one of the roots is indifference, because I think that I personally believe in holding people accountable to their actions, and in some cases, of course, they can't really control what exactly they're doing or what's going on in their brain, but in many cases, we know what's going on, we know what we're doing, we know what we're doing is wrong, and I think the root is that nobody cares. Fact of the matter is, I remember last year when I was a freshman, I'm not going to say I was like completely clueless as to about drugs and stuff like this, but when I got to high school, it was like culture shock. It was like, this many people do drugs, this many people drink, and I was like, we're freshmen, what? So like that's the way I saw it. But then other people are like, what are you talking about? This is like normal. And so for me, it was like, you have the opportunity not to do this. You know what this can do to you, and yet you still do it. And so the root sometimes we can say is school, we can say is stress, but sometimes it's the simple fact that students don't see a problem with it. I have one friend last year, he was talking to me and he was like, you know, marijuana doesn't actually do anything. It's just like leaves. And I truly was like, have you not seen cases whereby these drugs have actually done things to people, whereby people have lost their lives to taking drugs? And so it's the fact that they don't think that it does anything, that they're so okay with doing it. And it's not that they're caused to do this by stress, or not, it's not that he had so much going on in his life that he just had to use this drug, but it's the fact that he didn't see a problem with it. And so if we don't see problems with certain things that we do, then we do them, regardless of what other people say. And so I think that one of the roots, not the main or not the only, but one of them is the simple fact that people just really don't care enough to not do certain things.
I think that another root is that the expectations and standards that the school system has and the competitiveness between students is a big problem. It's good to have high expectations, but it becomes a problem when kids are identifying the highest expectations as the only expectations, because they're just stretching themselves too thin again. The amount of homework is also a problem. There have been days when I've gotten home at 2:30 and I've worked until 6 a.m. Just nonstop. I eat my dinner as I'm doing my homework. It's crazy. I don't have any time to rest. I don't have time to spend time with friends. And that's, again, me stretching myself too thin. And kids need to realize that these hard classes are, they need to make sacrifices for these classes.
And to add a little bit on what Kate was saying, that like we're taking health class for like every year up until 9th grade for me. That's like don't do drugs, don't do this, don't do that. It's been like shoved down our throat so much that some people are like rebelling against the school system. Like told us this so much that I'm going to do it just to show you that the kid does nothing or whatever they're going. It's just like they just don't really understand like the facts that it is bad. Don't do it. Like end of story.
Okay, so I'm thinking of two roots to problems. One is just simply chemical imbalances in adolescent brains. We are going through puberty. There are a lot of more and new hormones just going through our brains. We don't know exactly how to handle them. Sometimes it's just that. Another one I would say would be technology. Technology has limited the average teenager for a lot of like different socialization. I go to lunch and everybody's just sitting there on their phones. Like sometimes we have conversations and they're like, oh, I hate this teacher or something. Like they're stupid conversations. They're not even like good conversations. And they're just chilling on their phone the whole time. Like, I don't even know what they're doing. Probably like playing some Candy Crush or something. I don't know. Something not important. And that somehow in our minds, we've gotten addicted to this technology to the point where we can't even have a normal conversation at lunch. And I think that also adds to different mental health aspects. If you're on your phone, how are you going to socialize about how you're feeling? How are you supposed to feel confident in telling your friends that you're having something going on in your life if they're sitting on their phone and not even listening to you? Technology also gives us a false sense of inclusiveness. You can talk to people from around the world, people you've never met before, all through your tiny 6-inch phone. And that gives us a false sense of inclusiveness. You go home, you might totally talk to this person like constantly, who you've never met. They could totally be some faker, old person, like pretending to be a teenage girl, and you're like, oh my god, we're best friends, like this is so cool. No, like then so you start ignoring your friends and your family, and when this relationship ends because it's not really a good relationship, you don't really, there's nothing substantial there, it's not a good relationship, so when it ends, and you've lost all your school relationships, your real friends, and your family's kind of like, what are you going to do? There's nothing else to do. So I think that technology has really screwed up and made our society, especially teenagers, a lot less social, and in a way that adults can't really understand. Because we grew up with this constant use of technology. Adults, I mean, my parents probably had it, I don't know when you got a phone. I don't know, but definitely not technology like recently. Like we've had it our whole lives, like just right at our fingertips. So yeah, that's probably the main route for me.
So I think there's no main group. There is definitely several factors, but a lot of reasons why teens try out drugs is because they're teens. They're at an age where they want to be able to experience new things. You're at an age where you want to go traveling all the time, or you want to try new food or something, and drugs fall under that category. It's something mysterious, and you're attracted to it. But the thing is, and your friends are doing it, so all the more reasons, like why not? And so this is a problem, I think, but it's more so, like one of them has stated that we don't make it a serious enough problem, that we don't place enough emphasis on it. And yeah, you hear drugs are bad, but why? So I think we should have a curriculum or something, not necessarily curriculum, but something within each school where every year you bring your kids down, you take them to student services or something, and you teach them about it. Why are drugs bad for you? Not just because drugs are bad. And I think, I remember reading one of my friend's essays for college. I thought it was very generic, but it was basically talking about how kids nowadays, we're so stressed that we feel we can't be ourselves, and we want to do all these things. And I related to it. I mean, I see the attraction. I won't do drugs, but I see the attraction. So I think that this is something that actually all teenagers can apply to. I was reading this essay and I was thinking, this is all of us. We all are so stressed that we want to be able to do something outside of school, outside of like academics, that makes us feel like we're someone, not just a collection of what we do at school or something. I remember watching this TED Talk. It was given by this, I forgot his name, but this man who was talking about one of his friends who, you know, one of those hyper kids in class. And the teachers would be like, can you please calm down? And the thing is, we place so much emphasis on academics like math, sciences, all that, but have we ever thought that we should cater to our kids individually? That our kids that are hyperactive, maybe you should place them in dance class or put them in an art program. We place so much emphasis on STEM fields, and that may not be what they're interested in. And all people handle stress differently. I can handle 5 AP classes. It's okay. I mean, I still like sleep at like 4 a.m. some nights, but other kids, they might start crying because there's a test upcoming. Each person is different, and I think that this individuality needs to be catered to.
And before I get to the last question, if you have a maroon SUV, you left your lights on. If that's anyone over here. Okay. And then you made a good segue, and I'll give them extra factors. I think I'm not enough. But if you personally could recommend any policy change, any program, any next couple of steps that would make an impact in this issue within a short time period, so I say 1 to 2 years, what do you feel like that would be?
So I have 2 ideas, and one of them was touched on during the professional panel. It's the idea of starting to implement more social workers into the school system. Because right now our guidance counselors, I see more as a college advisor or an academic advisor. They're more to just help you with academics if you want to drop a class, if you need information on SAT, how to apply to college. And so they're more there for your academic purposes, but not really to talk about what's going on in your head or what you need to talk about. And so I think social workers should be implemented. And also, I think we've delved into this concept of just assigning a ton of homework each night, but it's not necessary. Like my government teacher, he doesn't give us homework unless it's gonna enlighten us or help us understand the class. But a lot of teachers are kind of just piling on the work because the way it should be is school is where we should go and learn, and then home is where we're going to be taking what we learned and implementing it into the real world. Like, I know that the mitochondria is the powerhouse of the cell. I know how to graph a parabola, but oh my god, like how do I pay taxes? Like, I don't know any of these life skills, and then I know all this other information because it's just been crammed into my mind, but I think that we're missing the key concepts that students need, and that's to give them programs, to give them classes where they can learn how to survive in life, not just how to thrive on an AP test, but how to actually make their way through college, get a job that they love, and then work their way from there in life, not to just be this academic pinnacle that we want them to be.
Let's start bringing learning back into our schools. Let's stop assessing every 10 seconds. Let's just take a step back and just learn. It's very important that we go to school and learn rather than have tests crammed down our throats. It's something that I've thought about a lot when I was joining this panel. It's something that I've been thinking about for a year or two, especially since I just came out of my junior year and I'm now applying to college's senior year. Junior year was very tough, and it did not make things easier when we had tests every 2 weeks for things that I didn't need to know, things that weren't going to help me in the now. It was a constant state of assessment when it should have been learning, it should have been knowledge, it should have been understanding the value of that knowledge and applying them to real life. And that's honestly, I think if we take a good look at what tests we're giving our students, we could really understand what to do better. And I'm not talking about getting rid of the chem test that you have after you learn a unit or the vocabulary test. I'm talking about the student learning objectives, the standardized testing. That's my pitch.
So I think that one thing that we definitely need to implement would be, for one, holding students a little more accountable to their actions, as opposed to trying to find excuses for them, which I think that is done. I know some things do have legitimate excuses for them, but I think that I've seen this a lot, but a lot of times students are kind of let off the hook because, oh, this and this is going on. So I think that one thing is that holding students accountable, because then if they are accountable, despite what is going on, they will still have that mentality that they can't just go off the rails just because they're having a bad day.
I agree with both of them, holding students accountable, and he was talking about a constant state of assessment. I think that you should understand what students are getting themselves into, understand why the students feel that they want to overwhelm themselves with all of this work, plan to balance school and happiness, identify the sources in a teen's life of stress, and figure out how to decrease those stress levels and keep them down. And I think that would all tie into cooperation of the parents, the school system, and the teachers, everyone that's involved in the school.
I have a few family friends that have done drugs here and there, and I understand the consequences of it, but things that the students don't really understand that, and they should bring those people in with the experiences of doing drugs so the kids can understand why not to do them and the consequences that get involved with them. It's I'm not going to do them because I understand the consequences of the drugs, but many of my friends don't. And without that knowledge, then they can't really make a good step in the future.
So I cannot stress enough the how much meditation or yoga has helped me in my life. I think that it helped me become more in tune with myself, and I was able to express how I felt more easily. The problem is enforcing that into a student's life while they're in high school or even middle school is unrealistic. People often think of it as dumb or stupid or not worth it, but I think the only reason why I benefited from it is I was pretty much forced into doing yoga and meditation, but it really helped me. I think if something like that is started at a young age, with even elementary school, and the children are able to become in tune with themselves, and it's continued onto high school, it's a great way to just keep yourself grounded. Also, I think specialized learning in some sort of way, like just the idea that people that have something going on are not strange or weird, they're just different, and being different is not bad. If there's some sort of specialized learning, like there's a kid with ADHD in the class, like maybe standing desks are a good option. They can't sit, so they have to stand. Something specialized for people so they can get the most out of their education that they need.
I think something that would really help is addressing those problems at home too. I've had a friend actually who, it was last year, she tried to commit suicide, and schools can't always save you. You can't always go to your counselor and talk about it, or your psychologist. You either do or nothing, and it doesn't help, or you don't because you're afraid. And a lot of times, your friends don't know how to help either. They're not experienced or knowledge about mental illnesses. They can't direct you where you want to go and what to do. And schools itself is a big factor, but also at homes. I think parents should educate themselves too on what mental illnesses are, how to address it, and how you should talk to your kids about it rather than be like, there's something wrong with you, what's wrong? You can't just go to them and be like, if they have an eating disorder, be like, you need to eat more. Or if they're depressed, and they're like, why are you so sad? It's not that big of a deal. So a lot of times it's just, people need to get more educated on mental illnesses, and for substance abuse, I think that can be in school, as I stated, that they should bring the students down to like student services and just talk about like consequences about drugs.
Perfect. So if we can give another round of applause for our students. And I think what's super cool about this panel is actually how it was formed. I definitely wanted to not showcase one type of student or a student from a particular area. So literally, I sent out an email with the questions and said, if you are interested, apply. So they're authentic answers. I didn't have any conversations with them about what exactly they would be doing. I didn't even tell them the dress code. So these are kind of cool that these are their authentic thoughts, and these are our authentic students in our county.
Yay.